Good morning, students. My name is Srima Jeevan. I am dealing community health nursing, unit number 4, epidemiology and the nursing management of common communicable diseases. So we our last class we has learned about the rickettsial diseases. So it's a zoonotic disease condition only. So out of that one, so we are going today learning about the Q fever. So it's a causative organism is Coxella burnetii, and it's a zoonotic disease condition only. It is caused by the ticks only, and Cornella is abundant in the tick fecal matters and all. So here this burnetii can able to survive in the dry fecal matters for a longer period also. So and this condition or a causative organism can able to stay in the milk of the infected animals. So particularly it is abundant in the product of consumption of contaminated environment at pasturage. So here if you are not pasteurize the milk, okay, so through that one also we can able to go for getting this Q fever condition. So actually this is not transmitted through the anthropoid vectors and all. So through only the contacts of maybe as biting hard towards us, we are infected towards to the or we are taking the contaminated animal product and all, we will be getting this condition. So it is actually not an anthropoid vector condition, is transmitted from the anthropoid towards the human animals. Okay, and how it will be transmitting means actually it may be as a human infection is caused by the occupational hazards, those are working in a farm and also if it is infected, the animals is infected with this condition, those people also will be getting this type of condition, that is Q fever. And a veterinary surgeon is contact with the infected animal. So in person handling who with the wool or a hides, then meat animals products contaminated with the Coxella burnetii, and the drinking of infected milk. So one how we are getting, so that is human beings are getting this condition and all is those are working in a infected animal farms or a surgeon, then those are handling with the woolen that is from the sheep and all. And if you are consuming meat product from a contaminated animal, and if you are drinking milk without the pasteurization, we are drinking from a contaminated animal means, so we will be getting the condition. So which are the route of entry for this condition means through the skin mucosa or inhalation or injection. Once maybe as through the skin mucosa or inhalated one respiratory, maybe as once you are consuming, that is taking inside the food. Okay, so it can be rare casely it can be transmitted from person to person, and ticks are not important in the human infections. Actually ticks and all, it is not an important case for the human infections and all, and it in rarely it will be causing transmitting from one person to the next person. Then human diseases. So acute, there are three sections are there, classification. First one is acute systemic infection, that is interstitial pneumonia. Second one is chronic infection, that is hepatitis, meningitis and endocarditis. Third one is spontaneous recovery is usual. So here how and all it will be causing means maybe it can able to interstitial pneumonia, which can be causing chronic infection like hepatitis, meningitis, endocarditis. And if you want to go for giving the treatment means spontaneously, you should give the treatment for the recovery. And Coxella burnetii is an obligate intracellular pathogen, pathogenic conditions and all. So here after the recovery in the tissue of the patient, maybe as 2 to 3 years it will take for the recoveries and all, because it's a latent infections. And in the I has told you before itself, in live fecal matter, not only in the live fecal matter, it can be liver. Bernite can able to live in the dried fecal matter for a longer period and all. It can survive for years also, and it cannot be destroyed with pasteurization by Holder method but flash method is effective. So pasteurization, actually when we are doing for sterilizing the milk center, we are doing the method is pasteurization. So if you are doing with the Holder method, we can't able to do for the destroying the Bernite organism. So with the help of flash method only we can able to pasteurize the infected milk content. So the lab investigation we can able to see. So culturing of yolk sac of the chicken embryo cells cultures, and we can do serology, we can do then isolation of coxilla from the blood, sputum, maybe as a stool, and other specimens also we can able to use, but not recommended due to the laboratory infections. So we'll be using only the cultures, serologies, and isolation of coxilla from the blood, sputum, as well as the stool of the person. And vaccination, formalin-killed whole cell trichloroacetic acid extract we can able to use as a vaccination, and it is a live attenuated vaccination. And some treatments we can able to use, but it should be in a spontaneous way, that is doxycycline treatment we can able to do. And I have told you in chronic infection cases and all, we can able to treat as soon as possible. If for a spontaneous treatment all we should do. So it's a chronic infection like endocarditis, so the combination therapy, that is tetracycline plus cotrimazole we can able to use, or tetracycline plus rifampicin is the treatment which is using for the in the case of chronic infection for the human. Okay, then next one is Indian tick typhus. Okay, so there are different types ticks are there. So Indian tick typhus, then it is an infectious disease that is caused by the Rickettsia conori, so which is transmitted by brown dog ticks and all. So it's a diseases predominantly it will be seen in Mediterranean areas such as India as well as in Africa and all. So we are studying here the major diseases which is affected towards the India in the Rickettsia diseases is one of the ticks diseases only. And the main onset is sudden onset of disease condition will be there, and incubation period about the 6 to 10 days. And here the symptoms will be including fever, headache, rashes with the scars, and which will be appears in the ankles as well as the wrist areas. Okay, and the treatment is a doxycycline and tetracycline. Either you can use the doxycycline or a tetracycline. Then rickettsial pox are there. So what is rickettsial pox means? Mildest rickettsia diseases of the human. One is a mild one only. So here has like a chicken pox only. The self-limited, not fatal and vascular in nature, and it was found especially observed in the New York in the year of 1946, and it will be resembling as like a chicken pox only. So it is known as vascular or varicella form rickettsioses. And here rickettsial acari is there, is the causative organism, and domestic mice is the reservoir of this infection. Mites is the vector, and how it will be can be isolated from is acari has also been isolated from the wild rodent in Korea and all. So usually it will be seen in which are the area means in the Korean area or Eastern European areas and all. And next one is Rocky Mountain spotted fever. So what is a causative organism is Rickettsia. So vector is ticks and reservoir is rodents and dogs. And what are the signs and symptoms will be there means sudden onset of fever, headache, muscle pain followed by the development of rashes on the wrist as well as the ankles, especially in palms and soles also will be there. Then this diseases will be difficulty to diagnose in early stages and all. Without the prompt and appropriate treatment, it can be a fatal one. Okay, and systemic complications will be there as like respiratory system, then central nervous system, central cerebrovascular systems, renal and hepatic complications will be there once you are not treated properly the Rocky Mountain spotted fevers and all. I have told you before itself, once we are learning about the last class, that is classification time itself, I have told you what are the symptoms and what are the complications will be there. And Rocky Mountain spotted fever is remaining seriously and potentially life-threatening condition only. So it need a effective treatment and appropriately 3 to 5% of the patient will be dying because of these infections and all. Abnormal laboratory findings we can able to see with the Rocky Mountain spotted fever, and it may be as a thrombocytopenia will be there, hyponatremia and elevated liver enzyme level. So in this condition you will be getting some abnormal level of laboratory investigations and all. So cytopenia, thrombocytopenia, hyponatremia and elevated liver enzyme levels and all. And investigation for the rickety diseases is PCR and serological test, which I have told you, Willis-Fells test and all we can do, IgM, then ELISA test and all we can able to do. And up to here I am teaching, and if you having any doubts you can able to ask me. To my next class we can able to learn about the test. Thank you.